It is 101, so we want to be respectful of your time. So, again, thanks for joining us today. A lot of you actually were registered for this a few weeks ago when we had the opportunity to run it. Unfortunately, we had a mishap in Zoom from the MASSP side of things, so we apologize. We had what ended up being a really good recording that Grace did. And we just thought instead of just sending out a recording, it'd be better just to rerun this webinar again. We know how powerful it is to be able to see this information in real time, to be able to ask questions in real time is super helpful. So we decided just to find a new date and time. So Grace Rudolph, who is going to be our guest panelist here today, I appreciate you being flexible, Grace, to find time with us to be able to do this again. And I think we had a majority of the people who registered last time register again. So that's exciting to see. So as they are coming in, we see people introducing themselves in the chat. So welcome everyone. If you are hopping on now, again, continue to do that. Looks like we even have a group of health and PE teachers from Northern Michigan on. So there's a nice group there. So thank you for sharing that. Just a couple of reminders before Grace takes over. This is a webinar format, so we have the chat open, which is great, but to actually ask questions for Grace and some of the content that you're going to see, we really want to push you to using the Q&A system. It helps myself behind the scenes kind of monitor what's coming in, going out. Others can upvote those questions. You can hit a little thumbs up sign. That will help us prioritize those questions and make sure that we're getting all of them asked and answered before our time is done today. Otherwise, you can continue to use the chat to just share ideas, comments, general thoughts for the group to see. And then we will send out this slide deck that Grace has for us, as well as the recording. I usually get it out the next day, so I should have it to you by tomorrow or Thursday at the latest, so you can take this information and share it with others back at your home schools. And this is just a little disclaimer we have at the beginning of all of our webinars, just reminding people that the information you are going to receive today is accurate through today, February 17th. Because you can watch these after the fact, tomorrow, the next week, month, year from now, you just want to be mindful that some of that information might be somewhat out of date, might not necessarily apply to some of the content we're going to see today, but especially some of the legal webinars and others that we host at MASSP, that is important. So just be mindful of the date at which you are watching. It is probably different or a little after when we originally recorded. And hopefully, if you enjoy your webinar today, you're going to have an opportunity to join us from some other webinars coming up in the next couple of weeks. So things related to some College Board courses, as well as the new cell phone legislation that just got passed in Michigan. So other than that, I'm going to stop sharing now. And I'm going to turn it over to Grace Rudolph from MDHHS, who is going to talk to us about youth vaping. Go ahead, Grace.
Thanks, Ryan. Can you hear me all right?
Yep.
Perfect. Thank you. And you can see my slides.
They are loading right now. Yep, we're good to go.
Perfect. Thank you. Hello and welcome everybody to today's presentation on youth vaping, nicotine, tobacco, and THC. My name is Grace Rudolph, like Ryan introduced me before, and I am the Youth and Young Adult e-cigarette consultant in the tobacco section for the Michigan Department of Health and Human Services. I will mention that I have no conflict of interest. There we go. This is our mission statement for MDHHS. And as we begin this presentation, I would like to take a moment and just make a key differentiation between traditional and commercial tobacco. Traditional tobacco is tobacco and/or other plant mixtures used by American Indians and Alaskan Natives for ceremonial or medicinal purposes. Commercial tobacco is manufactured by companies for recreational and habitual use through various devices like pipes, cigarettes, e-cigarettes, hookah, and pouches. So looking at the objectives for the presentation today, I would like to mention we will be covering two of the top three most common drugs used among youth in 2024, and that will be marijuana and nicotine. First, the presentation will build a comprehensive description of ENDS through historical events and trends. Next, we'll provide some education on the dangers of vaping, nicotine, and or THC. And finally, list the resources and actionable strategies that we have available to increase quitting attempts among youth and young adults. So as I like to start off a presentation, I always like to just do a very brief timeline, and that kind of helps open up the eyes of how quickly ends have taken over tobacco consumption among youth. And in 2027, ends entered the tobacco market. In 2015, with the introduction of Juul, e-cigarettes stormed the commercial tobacco market. And in the years following, there was a growth of 900% among youth users in middle and high school. And since the introduction of Juul, e-cigarettes has become the most commonly used tobacco delivery method for youth and young adults. By 2018, the U.S. Surgeon General declared ENDS use among youth and young adults an epidemic. And in December of 2019, policy was passed nationally to increase the age of tobacco usage from 18 to 21, and that went into effect immediately. In the years following the 2020 pandemic, we have seen vaping incidents on the rise within the state of Michigan. So first, we're going to cover what are e-cigarettes, their general adverse health effects on the body, and how you can identify signs of youth use. So ENDS, or electronic nicotine delivery systems, are also known as vape, vaporizer, vape pens, hookah pens, electronic cigarettes, e-cigarettes, e-cigs, cig-lights, tanks, and mods. And these are just some of the terminology that is used to ENDS. There's multiple different names. Throughout this presentation, though, we will refer to them as ENDS or e-cigarettes or e-cigs. And then I kind of want to go into just very basic understanding and education around e-cigarettes. And then we'll kind of cover some of the more adverse effects that they can have on youth and young adults. So e-cigarettes allow a user to inhale a flavored aerosol that contains nicotine, an addictive substance, along with other toxic substances that are suspended in vapor. E-cigarettes are composed of additional elements within the device that, when ignited, produce harmful nanoparticles. And they are the ones that are really suspended in that vapor. And then they are inhaled by the user or by innocent bystanders. Many of these nanoparticles are then lodged deeply into the pulmonary system, where they can cause additional harm to the users and others who inhale these vapors. So there are multiple types of e-cigarettes, and I'm not going to go into like a deep dive into them, but there are different generations of e-cigarettes. But mainly the three main types are mods, tanks, pre-fillable or refillables, and then disposables. And we know that disposables are the #1 use among youth and young adults currently, and probably the most common that individuals see within schools or when youth are caught or a device is confiscated from a youth. Regulation is limited on e-cigarettes throughout history of their since their introduction. And this has really caused ENDS to have a large array of alluring flavors and deceptive device designs. And I always like to mention that because people ask, well, how are there so many different devices when I go into a tobacco retailer? And it's important to know that regulation doesn't mean enforcement. So although they are illegal, they are still there because there is not an enforcement process strong enough to come after all the ones that are on the market right now. The cost of these devices are priced to be super affordable for youth and young adults and introduce a vast scope of adverse health effects. Research done by the Truth Initiative shows that e-cigarettes, since their introduction, have nearly tripled in nicotine strength with 6% or greater. And I've actually gone on web just to kind of skim through what's available out there to kind of keep in touch with what devices are available. I've actually found devices that have 9% or greater nicotine strength. They've also dropped in price by 70% with options of having interest-free monthly payments online, bringing the price down to about $5 per month. And so that really opens the door for affordability among youth. and they have increased in e-liquid capacity by 29 times the original Juul pod that was introduced in 2015. So what is found in the aerosol? We've been marketed and told that it's just a vapor, it's harmless, and really it's kind of opens the door when you look at this infographic and what's in the aerosol of an e-cigarette. It's not vapor, because vapor indicates that it's water. It's the gaseous state of water. And we know that it's not that. So the correct terminology is aerosol. And within that aerosol, we see nicotine, which is a highly addictive compound, and it is a developmental toxicant found in tobacco-derived products. I'm going to mention it now, but I'll go further into it in a little bit. But a lot of e-cigarettes are now even going into synthetic nicotine, which is lab-created, or analog nicotine. We also see ultrafine particles that are inhaled deeply into the pulmonary system. And a study that was published in the Journal of American College of Cardiology found that these ultrafine particles that are found in e-cigarettes increase the risk for heart attacks. We also know that there is a presence of adverse organic compounds that are chemical compounds that consist of carbon atoms that are bonded to other organic elements. And an article that was found in the Journal of Exposure Science and Environmental Epidemiology shows that these organic compounds are found in high concentrations within the aerosol of an e-cigarette. And a story that I saw just recently last year is a lot of new cars now have like a sensor within the internal that reads the internal air quality of the car. And an individual decided to just see how bad an e-cigarette aerosol was. This is not a scientist. It wasn't anybody who had ulterior motives to, bringing the adverse effects of aerosol out. They just wanted to know for their own personal sake. And it was picked up by local news. And what they found is when he exhaled just one puff of an e-cigarette out into the car rapidly, the sensor showed that it was unsafe, and it continued to climb past unsafe. And then what happened is it took hours for the car to refilter that air to make it and bring it back down to safe quality for inhalation of passenger and driver. So now we're seeing just one puff has such a vital attack, and that's really partly due to those adverse organic compounds. We also recognize that there are carcinogens or chemicals that cause cancer in living tissues. We see there are heavy metals. Most common metals that are found in the aerosol are nickel, tin, and lead. And according to the director of clinical research at Johns Hopkins University School of Medicine, the internal components of an e-cigarette, when they're heated, specifically the heating coil to turn the e-liquid into a vapor, has slough trace amounts of these heavy metals sloughing off of the internal components. Then they're trapped in the vapor and then transported into the pulmonary system of the user. And finally, we see flavoring. The most common flavor that can be found in aerosol is diacetyl. And that exposure to this chemical has been linked to a serious lung condition called bronchiolitis obliteration. And it's a serious irreversible lung disease that causes lung impairment, and is very similar to COPD or chronic obstructive pulmonary disease. It's also known as popcorn disease because of an incident that has occurred at microwavable popcorn factories, where the chemical was inhaled by workers. The United States Department of Labor and the National Institute for Occupational Safety and Health has since established exposure limits to this chemical to help reduce the likelihood of developing this irreversible lung impairment. And they also now recommend personal protection equipment, including like masks and, on the hand, gloves and suits, so it doesn't get stuck on clothing. And one thing I like to mention is it's very important to realize that inhalation is not the same as digestion. So although it was found in a popcorn factory, it is safe to digest because we have mechanisms, enzymes within our internal digestive system that break it down. Inhalation lacks those, and so the respiratory system cannot break it down. So what are some of the known adverse health effects that are affiliated with vaping? This is more specific to vaping in general, but it really does indicate a little bit more on the side of nicotine than it does on THC. We'll go further into the health effects around THC and vaping, but just in general, the side note is that this is really in relationship to nicotine. So research supports the evidence that our brains don't fully stop growing and maturating until about our mid-20s, even late 20s. Some adolescents' brains, since adolescents' brains are still developing into well into their 20s, nicotine can have a larger and greater adverse permanent impact on the developing brain. When a youth and young adult is exposed to a particular at-risk behavior like vaping, longer lasting consequences can formulate greater negative repercussions. So if we start at the brain, we realize that consistent and constant stimulation of the brain increases the risk for addiction pathways that can lead to the use of other and harder recreational drugs. And so how does nicotine really create those addictive pathways? It's really the high concentration of nicotine in the e-juice can alter our brain chemistry. So the process for nicotine addiction begins really with the nicotine affecting brain synapses. And since youth are developing those synapses much faster than adults, we see the greater adverse effect. And so what happens is nicotine binds and affects to those synapses, which causes a giant release of dopamine. And that's where we get that euphoric feeling that individuals get when they're vaping, which creates and activates more receptors to really fulfill the escalation of dopamine. Sometimes after long-term exposure, nicotine can no longer fulfill the increased receptors that have been activated that demand for dopamine. And so the users resorted to using dual use of nicotine and other recreational substances or dual using different products. And that's where we see individuals using pouches and vaping, or using cigarettes and vaping at the same time, just to kind of fulfill that dopamine demand. Other adverse effects of nicotine on the brain are decreases in concentration, learning, lack and decrease in impulse control, with a decline in personality and overall moods. ENDS also has a very complex and harmful relationship with the respiratory system. And some of these complications include, but are not limited to, coughing, wheezing, consistent bronchitis, difficulty breathing, asthma, pneumonia, and lung injury, which is an irreversible tissue damage that causes shortness of breath and chest pain. According to the FDA, these are some other additional adverse health outcomes that are affiliated with vaping, and that is disorientation, skin disorders like contact dermatitis or rashes, poor oral health, like all of a sudden mucosal lesions or cold sores, asthma, pneumonia, lung injury, covascular disease, seizures, and even potential overdoses. Other documented symptoms have included gastrointestinal complications like nausea, vomiting, diarrhea, with users complaining of symptoms like fatigue and fever, with abdominal pain within days of initiating vaping. Finally, less documented and still being researched is the vast effects of the multiple carcinogens that are found in the aerosol of e-cigarettes. Scientists are still learning the full effects of these carcinogens that are found in e-cigarettes, and as time continues, we'll learn more and we'll have more to share. So just taking a moment and discussing the signs of potential e-cigarette use within a youth. Please note that these are not all the signs, and they might not all be exhibited at the same time either, but they're the most common that we see when we start to identify youth vaping. We see an increased in desire for secrecy, and that's really the unwillingness to stay at home, always wanting to be out with friends or have activities that they need to go to, and that's really due to the need for increased privacy to vape. We see disappearing monetary funds or asking to borrow money, usually around $20 with a higher frequency than normal. We also see increased thirst, changes in mood, with increased irritability and sometimes agitation. Another sign can be increased desire for spicy or salty foods. And really some of the big ones that we like to kind of highlight and notice is in the new scents or smells of candy, sweets, or desserts when you enter a room where a youth has been previously or is still in. And that's usually the aerosol scent that is being released by the e-cigarette. And finally, random packages that are arriving to residents and the youth not wanting anybody to know that those packages are present at the house. They need to pick them up themselves. So now we're going to kind of jump into the two different substances. We're going to start with nicotine and then we'll jump into THC. So nicotine is a highly organic compound and it's present in all tobacco-derived products. Additionally, commercial tobacco companies, in order to kind of get around regulation, have created synthetic nicotine, which is lab-created nicotine, or analogs. And analogs are different molecules or molecular structures, but they act very similar to nicotine. These products are still addictive, and all forms of nicotine are widely recognized as a stimulant. The biggest effect nicotine has on youth and young adult population is on their mental health. Youth will use vaping as an experiment or as a coping mechanism for stress and or depression. But using nicotine as a coping mechanism in youth can increase stress and anxiety and depression along with other chronic conditions. And so we'll take a little further look on our next slide. And that really kind of leads into the addiction process of nicotine and how that can have such an adverse effect on youth. So the signs of nicotine addiction is in the progression to where teens are now dependent on nicotine. This can increase risk for other adverse signs within youth. Often youth will use an e-cigarette to deal with stress or anxiety. In contrast, nicotine or addiction to nicotine only really increases the level of stress and anxiety. Research has shown that nicotine is highly addictive, with some research indicating as addictive as recreational substances like cocaine, heroin, and alcohol. There are two types of dependency that I want to touch on. First is physical, and that's when the body needs the nicotine to avoid withdrawal. And the unpleasant feeling will only go away when they use or vape. The most common signs are restlessness and agitation. There's also the psychological dependency, and that's the feeling that youth need nicotine to get through the day. It calms their nerves and kind of helps them cope with anxiety and stress. The most common signs for nicotine addiction is cravings and feeling like you need nicotine to function, feeling sad, anxious, or irritable, withdrawal symptoms like restlessness and difficulty sleeping, needing larger amounts or more frequently using nicotine to calm, to feel calm, and that can be, again, in either quantity or concentration, and continued using despite having knowledge of the dangers of using nicotine, wanting to quit but are unable to quit. One thing that I want to touch on before we move into our next substances are what are the signs and symptoms of nicotine poisoning. Recognizing these signs and symptoms is really important to getting a youth the help that they need. Excuse me, youth often, once they start vaping, will also start to do a little bit more risky behavior. We've heard of youth dual using substances, dual using products, but also really something that I've heard is youth drinking the e-liquid without vaping it. Excuse me. And although our digestive system processes it different, we are getting a much higher concentration, and it's not nicotine at that among youth at that age are not supposed to be ingested or inhaled at any capacity. So really recognizing these early onset nicotine poisoning is vital to receiving life-saving medical attention. And to kind of back it up, we've seen an exponential growth in poison control calls nationally and statewide around vaping and nicotine. And so it's really important that we recognize them so that we can help youth. So some of the early signs of nicotine poisoning can occur as quickly as 15 minutes, but can take up to an hour to be exhibited. Signs include nausea, vomiting, abdominal pain, pale skin, sweating, an increase of heart rate and blood pressure. And when we say increase, we mean there's a large jump in blood pressure and heart rate. As the progression of the overdose kind of settles in, we see the loss of equilibrium, tremors, headaches, and even seizures with vomiting can be exhibited. And that's really, we're about at this time where we really need to seek medical help. It is paramount that the youth gets that attention, as the late phases of nicotine poisoning is very drastic and very, it could be life-threatening. We see diarrhea, and now we see blood pressure and heart rate take a massive dive and kind of go in the opposite direction, where we have really low blood pressure and heart rate. Individuals can go into shock, paralysis, they can start to struggle to breathe, and it can lead to unconsciousness. So some of these late symptoms can last up for an hour or two for mild exposure, but what's imperative is we don't know how large the exposure is. So it's important to get them before they get into the late phases of nicotine poisoning, because it can last up to 18 to 24 hours. And you could need assistance with breathing and seizure control as well. So in addition to tobacco, nicotine, e-cigarettes, I'm going to cover the growing popularity of using ENDS devices to consume marijuana or cannabis products. My co-presenter from the Substance Use, Gambling, and Epidemiology Bureau was unable to join us today, but she was able to provide me with a little bit of information, and I'm going to be able to present that today along with some of my own findings around cannabis vaping. Marijuana is most commonly consumed by smoking the dry plant material in joints, in a cigarette, blunt, or in pipes, also known as bongs. However, the use of vaping devices to consume marijuana or cannabis products increases in popularity over the last few years, especially among youth and young adults. Data shows that more than a fifth of high school seniors in the U.S. have reported vaping marijuana in the past year. Vaping marijuana can be difficult to detect due to the vapor being produced dissipating very rapidly, and the flavor of the e-cigarette covering the traditional smell of marijuana. However, vaping the substance can still result in bloodshot eyes, dry mouth, thirst, increased appetite, and shifts in mood and behavior. Additional signs of usage can be changes in friend groups, decreased in activities that were once enjoyed, decrease in coordination and reaction time, leading to increased risk for physical injury. Another sign of youth using marijuana can be vaping paraphernalia, including devices that are designed like USBs, toys, figures, drinks, smartwatches, inhalers, and gel jars with dabs or cartridges containing THC oil. Many marijuana vaping devices mimic nicotine devices and have similar flavorings, so it's very hard to decipher whether a youth is vaping tobacco, nicotine vapes, or if they're vaping THC vapes. THC is the primary psychoactive compound in cannabis or marijuana, with intoxicating effects of temporarily altering a person's mood, thoughts, or perceptions. Electronic vapor devices allow for vaping of dry cannabis herb, but can use oils and concentrate. But the use of oils and concentrations are on the rise. Marijuana concentrations contain extraordinary high levels of THC, ranging from 40 to 80% THC, but can have upwards of 95% or greater. Personally, I have found pure THC concentrations on the web, and there are YouTube videos where a youth can go on an unrestricted YouTube and find videos on how to make their own THC concentrations. And so this is all very accessible for youth, easy to find. And it's very dangerous because youth don't understand the dangers of making their own. I'd also like to kind of mention, and it's kind of a joke, but it's not your grandparents' marijuana anymore. According to the Drug Enforcement Agency, in the 1990s, THC was around 4%. In mid 2000s, THC levels rose to about 16 to 17%. But now, like I said earlier, we're now seeing concentrations of 95% or greater. So there's just this massive jump in the concentration and the potency of THC within devices. Additionally, this is concerning as smoking or vaping these high concentration oils or extracts can deliver large amounts of THC, increasing the risk for adverse health side effects. So vaping marijuana is particularly concerning for youth because of the adverse health effects and the risk it puts on developing brains and lungs, very similar to how nicotine does. So data tells us that individuals that use prior to the age of 18 have a greater likelihood of 4 to 7 times greater for developing marijuana use disorder than those who start using marijuana as an adult. Like mentioned earlier, the brain is still developing some of those important skills to problem solve, impulse control, into anticipating consequences, and more, really until our mid to late 20s. So marijuana, much like nicotine, negatively impacts the development of these skills and can often impair skills like coordination and reaction time, which are really key for what we're seeing at this time frame, which is youthful drivers. And so individuals who are using these substances can have an adverse effect as they're driving vehicles, as they're going out and doing things more independently. They're getting the reduction of developmental skills that are important for survival and growth and maturity. Marijuana use is also correlated with declining in school performances and increased risk for developing or exacerbating mental health issues like depression, anxiety, and in some cases, psychosis. And individuals who have family history of psychosis will exhibit it more and often more aggressively than individuals who do not have a history of it. Lung health of an adolescent is also at risk when using marijuana, similar to nicotine e-cigarettes. During 2019 to 2020, presence of vitamin E acetate, which is like a thickening agent in some e-liquids, was associated with acute lung injury, which was termed e-cigarette or vaping associated lung injury, or E-Valley. Data shows that THC containing e-cigarettes with vitamin E acetate were linked to most cases of E-Valley. The outbreak resulted in over 2,800 emergency department visits and 98 confirmed deaths. Vaping, as mentioned before, is associated also with asthma and asthma exacerbation. And I also want to mention that there are devices now in the market that have been confiscated, even locally in the state of Michigan, that allow a youth to vape both nicotine and THC at the same time. So they'll inhale and get both substances at the same time. So we're really seeing an advancement in devices and also really getting youth addicted to some of these really potent and very high concentrated substances. The recent data has shown that perception of harm among youth regarding to marijuana use is decreasing. In 2015, 23.2% of youth ages 12 to 17 perceived great risk or harm from smoking or using marijuana once a month. However, in 2022, only 16.7% of students perceived great risk from smoking or using marijuana. Research has shown that a decrease in perceived harm of a substance is associated with increased use of that substance. This data supports the importance of educating youth and parents and guardians on the harms of vaping nicotine and marijuana. Before providing a list of resources, I'd also like to share a little bit more on data and information that I have pulled from the University of Michigan's research and some data from their Monitoring the Future project. So according to the National Institute on Drug Abuse, there has been an increase of flavored marijuana vapes among younger teens from 2012 2021 to 2024. Eighth graders jumped from 47% to 63%. 10th graders have increased from 41% to 53%. 12th graders have increased from 36% to 50%. So we really see that flavored vapes really help almost encourage more youth. It drives youth to use because they don't get that don't get that traditional smell, and also it's flavored, so it's a little bit more appealing, especially since most of those flavors reflective of popular sweets, candies, and desserts. Synthetic manufactured THC has similar dangers around dangerous residues like corrosive toxic chemicals that are very similar to sulfuric acid and other problematic chemicals. According to Monitoring the Future 2025, vaping nicotine is higher among 8th, 10th, and 12th graders than vaping marijuana. We see that vaping either substance is higher among females than males, and among those who do not plan on attending a 4-year college or university. The Midwest has some of the highest vaping incidents for both substances, and that's typically because the state of Michigan lies within what's called Tobacco Nation, and that's where there's higher rates of youth using commercial tobacco, and lower funding rates for tobacco prevention and control. Nicotine vaping is also the highest in rural locations. So before I jump into tobacco resources and strategies, and some of them can cross a little bit over into cannabis use, especially around strategic or sustainable strategies, I do want to share some of the resources that Jamie provided to me for THC vaping. And that is looking at behavioral health clinics found locally in your communities, substance use disorder locator at michigan.gov, SAMHSA's helpline, Michigan's crisis and access line, or MyCal at michigan.gov. And I'd also like to share that their Stanford Medicine also has a prevention education that is very extensive. They do a phenomenal job. It's evidence-based. In addition to their prevention education, they also have an alternative to suspension program for cannabis vaping as well. So we're going to kind of jump in back into tobacco. And if you have any questions around THC vaping, I am more than happy to help. Otherwise, at the very end, Jamie's contact information will also be posted, and you can reach out to her as well. So My Life, My Quit is an evidence-based treatment resource. It's self-guided. It's for Michigan youth tobacco, quitting. And this program is free to Michigan youth ages 13 to 17 and can be utilized as an alternative to suspension. It is not its original intent. It is meant as a tobacco dependence treatment program, but there are learning modules that can be affiliated with helping a youth use it also as an alternative to suspension. Youth can receive one-on-one support with professionally trained coaches through live texting, online chat, or phone. It is confidential and free. My Life, My Quit also has a live app in both Google Play and the Apple Store. Also within My Life, My Quit, there are resources, printable, on-demand education, and although it can be used for commercial tobacco, it also kind of specifies specifically to a page on vaping. And there's also a couple other resources that they have built out on there too. Here are some additional national quit programs. Not all of them are free. This is Quitting, it's not free, but there are some other ways to assist and help youth if they've already gone through My Life, My Quit, and they just have not felt that they've gotten, they need a different approach. But what I'd like to jump into now is just some of the partnerships that we have built with the American Lung Association that are available for K through 12 schools for free through the tobacco section. So the American Lung Association has an intervention for nicotine dependence, education, prevention, tobacco, and health, or in-depth. It's an evidence-based alternative to suspension program, and it provides school with an alternative to out of school suspension or also citations. It's facilitated by a trained adult in one-on-one or small group settings. There are 4 50-minute sessions. They are really built to educate students on tobacco nicotine addiction, how to make healthy choices into habits, and initiating quick attempts through evidence-based programs. One of those that complete in depth, 60% of them indicated they are ready to initiate quitting or desire to quit.
And Grace,
Hey
Grace, I just dropped a link because we are going to offer a webinar on the Alternative to Suspension program in April. So if people are interested in learning more about that, I did drop the link in the chat.
Thank you. Awesome. Yes, thank you. And that will be with my partner, Michelle, who works at the American Lung Association. She's phenomenal. And she will give a lot more information than I can, but just wanted to give a preview of it. And I appreciate you dropping that registration link in as well. In addition to that, the American Lung Associations partner with the tobacco section to provide small group collaborations or COPs, community of practice. The community of practice really encourages community collaboration among peers, allows communities to ask questions, share best practices, learn more about additional support resources. These community practices are planned for February, May, and September. We're going to move probably the February one out to March, so it'll be March, May, and September. For this community of practice, the best practice is to have teams of 2 or 3 sign up together, and that's really to kind of help support momentum and to allow yourself a little grace. We all know that working in a school, you have to pivot really quickly sometimes. Sometimes you get pulled out of meetings for helping with assist teachers and educators in the hallways. And so having 2 or 3 people sign up allows you coverage, allows you to still learn without missing out on the information that was given, the questions that were asked. And also, once you're done going through the community of practice, it still gives you a team to kind of work with to kind of build the resource and implement it if it's not already into your schools, but also help support if you do have it implemented. How can you kind of troubleshoot complexities to getting this, having a little bit more excitement around it? So teams can contain multiple disciplines. We suggest administration, school counselors, SROs, educators, community members who are passionate about substance use, or volunteers, and school nurses. Another resource that the American Lung Association has is NOT, and it's an interactive group program that gives students the help that they need to break their dependence on nicotine. It's designed for teens to address the issue that are important to them and help them find healthier ways with dealing with triggers and challenges to quitting nicotine. The program takes a holistic approach with each session using a variety of different interactive learning strategies based on the social cognitive theory of behavioral change that can be applied and practiced in everyday life. NOT encourages a pathway for youth in middle and high schools to begin their quit journey. And what's really cool about NOT is it's founded that it's supposed to be facilitated within a K through 12 setting, within school settings. So supportive of the busyness that can happen. Not on Tobacco also has outcomes for this program that found 90% of participants that have completed have indicated that they have quit or reduced by the end of their sessions. NOT facilitator training is available online 24/7 and can be completed at the facilitator's capacity. Training takes about 5 to 6 hours, and the training registration fee is $400. All trained adults receive a NOT facilitator's guide and a certificate of completion along with other resources. So MDHHS is offering full scholarships for NOT training. Applicants must complete in-depth training, which is free, and it's only about 2 to 3 hours, and much very similar to NOT, it's at facilitator's capacity. So you don't need to do it all in one sitting. You can break it out over a little bit. On average, both trainings with stops in busy life take about 7 to 10 hours. Rolling scholarships will be available up to September 28th, 2026, and it's really based on what is left. We have capacity for several of these scholarships, but we are hoping that schools utilize them to help facilitate quitting and address tobacco dependency within their district. If you're interested, please reach out to me, and I will also pass along to Ryan the survey link, and you can sign up through the survey link. If your school needs additional guidance or language around traditional tobacco and how to put that into your policy, here are some great resources for that. Here is where our data citations came from. And these are our contact information. Mine is at top and Jamie's is at the bottom. Please, again, I will share the slides with Ryan so you can pull it off of there, but definitely don't hesitate to reach out if you have any questions. Thank you so much.
Looks like we have potentially a couple questions. One question was on the NOT program. Who is traditionally facilitating those sessions with students in schools? Is that how it works, and who would be doing that?
So it's whoever's trained, and you can leave that open to whoever has capacity. I have heard different. I have heard school local coalitions that came in and did it. They had not trained facilitators. The local coalition, who was clearanced by the district, came and did it. Local health departments can help with that. Additionally, what's nice is you're not always guaranteed flexibility and gathering, from the community. They're not always readily available. So you can have your school nurse, you can have a school guidance counselor. I would say somebody who trusts the students' trust, somebody that is a safe adult, that has great rapport with youth, that is willing to encourage and help them. Because I think that's where you're going to get the most success, is with somebody that is trusted among youth. I hope that was helpful.
No, I think that makes sense. And then I thought you had it on a slide, or there might have been a link within the slide. Unless you're able to drop it in the chat, they were looking for some links to specifically some of the THC vape use resources.
Oh, yes, I can do that.
Awesome. And then I see, it looks like Sharon has her hand up. I don't know if that was on purpose to ask a question or on accident. So Sharon, if you want to respond in the chat, maybe let me know. I can even unmute you if that's easier. Oh, okay. No, that was an accident. All right. Again, now is a great time to pick Grace's brain here and ask any questions about any of those programs she mentioned, going all the way back to some of the nicotine and THC look-fors and some of the dangers there. She's dropping in some links right now. And again, you will get the slide deck, which has the links that look like that were embedded in the slides, as well as the recording. And anybody can have access to that. So once you get that information emailed to you by me, you could absolutely forward those things on to others at your school or other teachers, guidance counselor, any of those people who work with students on these important issues. Just going to check the Q&A one more time. I'm not seeing any questions there. All right. Well, Grace, as always, good connecting with you. Thanks for that update. I think I mentioned that we are coming back to talk about that alternate, route to suspension in April. And then I know we already even have a couple of webinars planned for next school year to August and September. And so people can go to massp.com/events. They can see all of our upcoming webinars, trainings, and those are listed there. Oh, we got one more question in the Q&A, Grace. Are there certain programs which work well for students using it individually? We don't necessarily have the ability for a small group, or maybe even like the old school assembly approach. It sounded like the alternate program sounded like it was good for like a case-by-case individual basis, but I'll let you answer that.
Yeah, so that's a great question because we get that a lot. And so actually not and in depth can be utilized per person via one-on-one. The facilitator doesn't necessarily have to be there. There's two different modules to it. One is in the small group, it's on demand. And then there is another one where it's all done online. And it's kind of allows, but you need a facilitator to check in with that. You just to make sure that they're if they have questions that need to be asked, maybe they're struggling with one of the concepts that is being taught, or they just want a little bit to bounce some questions off of. Those the online still needs to have a facilitator help them. So you still will have to have a trained facilitator within the schools. But yes, the online module allows one-on-one, especially around youth that don't feel comfortable or don't want to be in a large group. We often say as well, maybe it could be used as the second offense as well. So we have the first offense, they're in the small group, they're talking, and then, they can go into the singular one by themselves for the second violation to tobacco policy, just so they're not being sent to suspension, out of school suspension, where they're bored and then they go back to vaping because they're stressed, they are bored, they're anxiety is filling, there's isolation. And so those are some great ways to do that. You can also reverse it where the one-on-one is first and then the group is the second offense, and then utilizing My Life, My Quit as the third. And then there's also Stanford Medicine, in addition to having a cannabis alternative to suspension, also has a tobacco. There's just more tobacco alternative to suspension than they do, unfortunately, THC, because THC vaping is fairly new. But I would assume that a lot of our national partners are recognizing that, and they're starting to mobilize and move in building some of those resources. But they do take time. You got to recruit all the right partners at the table, including parents, educators, clinicians. And so it's just really making sure that they're comprehensive in their approach.
Awesome. Thanks, Grace. And finally, and then we'll get you out of here. I think this comes from our health teacher group that was all working together from Northern Michigan, but they want to know, so how do you answer the question when a student asks, are cigarettes safer than vapes? And I was going to ask something similar when you were doing the percentages and stuff at the beginning with percent nicotine and percent this. And so do you have a go-to answer for the people who get that?
Absolutely. That actually comes a lot. And the biggest thing is that that I tell individuals is there is no safe amount of or safe exposure to nicotine in a youth. It's very simple across the board. We are seeing that, and I can do numbers really quick as well, but when you have an e-cigarette that has a higher concentration of nicotine, they're getting addicted much faster. So initiation quickly turns into addiction. Cigarettes have less nicotine in them than a vape does. And the question around like carcinogens and what's in a cigarette is, I leave it to this. It took us decades to figure out how bad cigarettes are. We're in the very beginning of figuring out what is bad about e-cigarettes. And it's taking a while because we're constantly changing the substances that are found in e-liquids. We're constantly or not we, but the commercial tobacco company is constantly changing all the components and making it very difficult for researchers to really fully understand what is going on with an e-cigarette. So it's very simple to say there is no safe exposure to nicotine tobacco, excuse me. And we don't know the full effects until we have further investigation into these devices, and that could take decades.
All right. Thanks, Grace. I think that is all of the questions. So again, thanks for joining us, everyone. You'll get that recap email from me in the next day or two. And hopefully you're on the massp.com/events page checking out when our next MDHHS webinars will take place, as well as some of the other webinars we have. So thank you for your time, everybody. Enjoy the rest of your day and week. Take care.